after 4.5 years, like I think 2 weeks ago, for the first time, I had that thought. I thought, when I was like seeing this pediatric patient in the hospital, and I could really relate to that patient, I thought, for the very first time after 4.5 years, I'm glad I went through that. Mm-hmm. So maybe to my former self, I would say, hang in there. You're going to get there.
Yeah.
It seems impossible to you right now, but one day you're going to get there. Yeah.
Welcome to The Summary, a podcast from Mary Free Bed, where we explore physical medicine and rehabilitation, one topic at a time. Together, we will gain insights, discover innovations, and deep dive into the latest developments in the field.
Welcome back to The Summary. I'm your host, Dr. Yunna Sinskey.
And I'm Dr. Doug Henry. And today we have a very special episode. Instead of focusing on a certain medical topic, we're going to talk about what is it like when the physician gets a serious illness, and how does it affect that physician? How does it affect the care that they provide? And our own Yunna Sinskey had a very serious, almost deadly illness, and still has some physical and emotional sequelae from that. And she's agreed to tell us about her experience and how it even affects her right now. So, Yunna, it was early COVID.
Yeah,
you were,
oh my gosh.
Yeah, you were a PM&R resident here at Mary Free Bed.
Yes.
And doing your pediatric rotation. Which,
with you.
Of course, was your favorite. Yeah. And we were down in clinic, and you pulled me into a room.
In all of our COVID gear.
In all of our masks and stuff. And said, Dr. Henry, I have awful news. So tell us your story.
Yeah, basically, I was diagnosed with stage 3 rectal cancer. And to be honest, they diagnosed me on the spot. They did an exam and they said, you have cancer. We don't have the pathology yet, but this is 100% cancer. Start getting ready for treatment and things like that. And I still waited, hoping that maybe they're wrong. So even though they told me right off the bat, I waited. And then a few days later, they called me saying hey, the path result came back positive as expected. So we're going to start the treatment for you. And that's when I called you into the room. Yeah.
Yeah, and so your parents, your brother in Korea, your sister who's a physician is in California, and here you are in Grand Rapids, Michigan.
In the height of COVID.
And you get this devastating diagnosis. So first of all, what was that like?
Ooh, what was that like? I remember sitting in my living room with my two dogs. No, actually just one dog back then. And then sitting there, and then I got the phone call. And even though I knew, I was definitely in denial. And once they told me, I think my mind actually went into not work mode, but what do you even call that mode? It's okay, now I need to begin. It wasn't panic and I don't know what to do. It was more okay, what's next? What do I do now?
Business. Let's get down to business.
Exactly. Let's get down to business. So I called my sister and I told her the news. She was the first person I called. And she was like, okay, I'm going to be there tomorrow. I think she was in the OR and she actually picked up my phone call because we really never call each other during work hours. And she said, I'm going to be there tomorrow. So she was flying in. It was definitely a whirlwind, but I was in work mode. It's okay, let's get down to business. Yeah. I think, I don't know, that's a hard thing to even think about.
But then you decided to go out to California for treatment. And what happened out there?
Moved to California in a few days. I think I got my colonoscopy here, because I just got the sigmoidoscopy for the biopsy, then got the full colonoscopy here, then decided to transition all my care to where my sister was in California. Went there. Oh, you know what? One thing that really was distinctly different was to walk into my sister's hospital to get my MRI. And it was at nighttime, and I actually got it in the pediatric unit instead of the adult unit because my sister is a pediatric anesthesiologist, and she knew all the stuff there. So I went in there in the middle of the night, And for the first time, I felt like what it felt like to walk into the hospital as a patient instead of a provider. So, you're in residency, all your friends are at work, and you walk into the hospital and you're like, yay, going to work, going to see all my friends, going to see all my favorite patients. Like that feeling is how I walk into the hospital. And that's kind of how we walk into the hospital. But when I walked into the hospital as a patient, it's eerie. It's like, oh, wow, so much fear is installed in you. And you just feel like tiny as you're walking in. And the hallways give you this chill and fear instead of that bright, warm, and fuzzy feeling we feel when we're walking
Even
through the
at
doors.
a children's hospital.
Even at a children's hospital. It's you don't get that feeling at all. You're just like, oh my gosh, I'm about to go for chemo. I'm about to get fully diagnosed. I'm going to get my PET scan. And all those thoughts are in you. And everybody's so kind. Everybody's so nice, especially in the onc unit. Everybody's so gentle in their deliveries, the way they talk to you. But even then, everything is just a whirlwind. Yeah.
And then you had surgery and some complications.
Yeah, so initially they got the PET scan and they were pretty confident it was stage 1. So then they said, okay, let's just go for surgery. And after surgery, they said, oh no, actually your lymph nodes came back positive. You have to go through chemo. So there was a lot of back and forth through that. And then I started to have this abdominal pain after initiating my chemo. And very normal to have belly pain after chemo. But the pain kept escalating despite getting further away from chemo. And there was a point where they gave me an oxycodone. And that was the first time I ever tried an opioid, so I was kind of very, very afraid to take it. But I took it and I felt like a sudden relief in this abdominal pain. And I was like, oh, okay, I guess all I needed was a little bit of opioid. I guess this is why people take it. And then I started eating a little bit because up to that point, I didn't make that connection back then. But looking back, I was getting abdominal pain each time I was eating food. And so because I wasn't having pain, I actually ate food for almost for the first time, maybe a full bread or something like that. And then excruciating pain started coming. I would say that was a 10 out of 10 pain for the first time in my life, that experience. I was on the ground on all 4 limbs, shaking profusely, and you can't even scream because it's so painful. I was shaking and I was just sweating like crazy. And that's when I was like, okay, I have to go to the emergency department. This is something much more serious.
So you went to the emergency department, and then what happened there?
Went to the emergency department. I don't remember much because they loaded me on a lot of IV Dilaudid because I was in so much pain. But from what my friend and my sister told me is they rushed me to the OR, and turns out I had ischemic bowel. So they did an emergency laparotomy, and when they opened me up, all my bowel was dead. Everything was purple already. And they said, this wouldn't be viable with life. So let's see if we can salvage at least something. And then I was in the ICU. They had my belly open because I was so edematous that it wouldn't close at all. And 12 hours later, I started crashing. Despite being on multiple pressors, my blood pressure wouldn't sustain. So they took me back to the OR after 12 hours, and they said, okay, everything's okay, because they thought the bowel was necrotizing at that point. But everything was still purple, but there were some patchy areas of pink. And I remember having this conversation with and then basically went back to the ICU, intubated, sedated, and then 12 hours later, again, they took me back to the OR, and they said they opened me up, and everything was back alive. So everything was pink, so they didn't have to resect anything at that point. And then I think I was intubated for about 10 days at that point. What was interesting was actually my medical school experience. I've had somebody like that in my experience where we went in and all of the bowel was completely purple. and again, non-viable with life. And I remember it was a chief resident who said, okay, obviously we can't resect everything out. What do we do? So we're just going to put our hands over the abdomen and pray. And we're just going to say, we're going to close them up. And the next day, I remember everything was back to life.
Really?
And I told my sister that story remotely. I was like, oh, it was such an interesting case. Like, I don't know what to say about it. I don't know what to think about it, but this is what happened. So when that happened, my sister said she told that story to the surgical team and said, can you just please do this for me? And my sister's like, back then wasn't even Christian. So it was just like, can you just please do this while you're in the OR, while her like abdomen is open? And it was strange. It's like a full circle moment of like, oh, wow, that happened.
Wow, that is full circle. Wow.
Yeah. I remember, I don't know why, probably have some kind of weird liver metabolism. I was on 3 different like sedating medications, 3 different like propofol, ketamine, and maybe Versed. I don't remember what it was, but I was wide awake in the ICU. Intubated.
Yeah.
And I remember the ICU attending physician bringing in the residents and showing me at the door and saying, I have never seen anything like this in my life.
Really?
But I was wide awake, writing down, like communicating, like, can I get extubated, please, and things like that. So, yeah.
What else were you writing? Who are you writing to? Your sister? Or
my sister.
The doctors?
Yeah. Apparently, one thing they ask you to kind of get to know you in the ICU was, what's your favorite breakfast? Or what's your favorite food? And I wrote down, Yoo-hoo? The chocolate milk. I've never tried Yoo-hoo in my life. But apparently, that's how delirious I was. I was having severe ICU delirium. But when I was awake, the first thought I had was, I don't want to do this anymore. It is so physically taxing. Because you're so delirious, mentally, nothing is really taxing. You're just really out of it. But physically, being intubated, your body recovering, everything was just so much. So on the board, I remember writing like DNR, DNI to my sister. I was like, you just got to let me go right now. And my sister would be like, no, to the ICU doc. Like, she doesn't know what she's talking about. She's confused. Don't worry about her. Like, obviously, she's already intubated. Like, we're not going to extubate her. But I meant it. I was like, please just pull the plug literally on me and just let me go. It's like, this is too much.
Was it pain or was it just the whole situation? Like, why are we doing this?
Kind of, why are we doing this, I think. I wasn't in any pain. I don't remember being any pain almost like ever. But physically, like, why do I have to go through this? What's the meaning of going through this? Like, it's okay to just die. There's no harm in really dying as a patient, right? As a patient, it's okay to die. Yes, it is very hurtful for everybody around you. But at that point, I was thinking, I gotta go. I can't do this anymore. I can't continue on. And I know we talked about this, but that feeling lasted a long time. At least 3.5 years of even the tiniest thing that emerged. It's not like, oh my gosh, I'm so depressed. I wish I wasn't alive. I should XYZ. It wasn't like that. It's very different from how you think about depression. It was more... So I kept thinking, like the tiniest things. For example, I was coming to work and a car like cut in front of me, in front of the hospital. And I was like, oh my gosh, like, why am I alive? Like, why do I have to go through these things in life? You know me, I don't even have like road rage or anything, but the tiniest inconvenience. And I couldn't understand why. I knew I was having these thoughts. I knew I would like ever try to kill myself or anything. I knew I would never do that. But these thoughts kept popping in. And I asked Nick, my fiance, about why he thought that was happening, like yesterday. And he said, he said, I think what was happening was you were barely surviving in every single way. So you were carrying like 100 pounds constantly. So another pound will break you. And you're right at that threshold. You're barely surviving, and then this comes on, and you're already beyond that threshold. And I was like, that's exactly what was happening. But I can't realize that. All I see is I have this feeling that, man, why did I make it? What's the point of me making it? Like, why is that so important?
And 3 years later, you still
Yeah.
kind of had that feeling. And 3 years later, what kind of physical issues did you still have?
Well, because they removed my no, they didn't remove, they removed my rectum. I still had an anus, which not everybody gets to keep. Because the rectum, and then they just directly connect the colon to where the rectum was. And because of that, I was having a lot of bowel problems. They call it low anterior resection syndrome, where you cannot hold your bowel movements. And because of the gastrocolic reflex, every time you eat, immediately you have to go to the bathroom. And it's the feeling of, you know how like when you have intense diarrhea, you're like, I gotta go now? Mm-hmm. It's that feeling. And that goes from 0 to 100.
Every time you eat.
Every time. And now I read it on Reddit. My friend forwarded me this thing on Reddit of like how other patients are controlling their bowel programs. So now I do a tap water enema daily. I'm on Imodium. I'm on Gas-X. So those 3 combinations together, now I can travel. Now I can work while I'm eating, because I would just starve myself all day. I would lose like 8 pounds during the weekday, and on the weekend just trying to catch up. Nick said I would go to the bathroom on average 30 times.
Really?
And he said he didn't know what to do. Like, I was like, oh, wow, is this it? We even thought about buying a RV with a bathroom in it so we could like travel again, because we love traveling.
Oh.
So that's, yeah. And even now I do my bowel program every day. I didn't realize how emotionally, mentally degrading it is to do a tap water enema. And how long, even nowadays, so I try to numb myself by watching YouTube while I do it, even now. But initially, I remember just laying on the ground and just like crying and being like, oh my gosh, like I have to live my life like this for the rest of my life. Now it's more like, oh my gosh, such an inconvenience. Like, just get it over with.
You're a little more used to it. Mm-hmm. But is that a big part or just a little part of this reason 3 years later you're still feeling like, oh, I wish, if I died, that'd be fine?
I think one part about if I died, I'd be fine is because when I was so close to death, because everybody was like, oh, she's not going to make it, I realized I wasn't afraid to die. Like, and that's such a freeing feeling in some ways of, oh, wow, I'm actually not afraid of dying. Yes, I am afraid of the process of dying. Like, what if I'm in a lot of pain? What if I drown and it's going to hurt my lungs? And I think about those things. But because I was so close to it, I'm not afraid of it. What's really hard is living after cancer with, one, you're physically exhausted. Even now, I don't recover like I used to. And I didn't have any like past medical history or anything like that. I was really like, quote unquote, healthy, I guess. But still, even being 4.5 years out, once I get fatigued or beyond, like, I cannot catch up. And it takes me days and days to recover, unlike before. And the PTSD, it really is significant PTSD afterwards. Because when you're going through cancer, the answer is very simple. It's like, do you want to live or do you want to die? Like, are you going to go palliative route or are you going to go survival route? If you want to go survival route, this is the route you go. And you don't really make any choices, per se. But then once you're back to work, once you're back to real life, you're still carrying that mental, physical trauma, but you have to get back to residency and perform and take care of other people. And that doesn't wait for you, right? Residency is kind of like, oh my gosh, you just keep going forward. That was really hard for me. And sometimes, like, I've had, you know, attendings be like, oh, you know,
Take a minute. So, I guess how long were you in the hospital in California?
total of, I think, in hospital stay was 4 to 5 months.
Yeah.
I think it was NPO for 6 months because they couldn't figure out what the problem was. But you know what's the most traumatizing thing out of all of that? It's the NG tube. NG tube is really horrible.
See, I think it would be horrible to ask you what your favorite breakfast is while you're intubated.
That's true. Luckily, it was a Yoo-hoo, right? Yeah. NG tube is... now I understand.
It's a long time to have an NG tube.
And I think it was even worse because it was in and out, in and out, in and out.
Yeah.
So it's like every time it was in, it was about 1 week. Because in the end, they found I had like some kind of obstruction from the scarring from the ischemia. So, but I had like 10 CTs, like 4 MRIs while I was in the hospital, but they couldn't figure it out. In the end, they figured it out with a colonoscopy, with a repeat colonoscopy. They were able to find it, but yeah.
And, you know, you're a physician. You have a decent idea of what's going on. Are you trying to help them out in any way? Or are you just like, just fix me? I'm just going to be a patient.
My sister and I made a decision to not interfere with my own care. Because we've seen that, right? Being on the other end, sometimes when you're trying to get quote unquote special treatment or trying to like guide the treatment team and not allowing them to do the thinking for you, sometimes that can cause some problems down the line. So we were just sidelined. Like I remember in the beginning, I did not tell them, like we were in the medical field. Of course, like they knew my sister, but they didn't know I was in the medical field. So I didn't say anything. I would just say, okay, yeah, that sounds like a good idea. Let's do that and things like that. But I wouldn't change that. I would do the same. I wouldn't interfere.
You were in the hospital several months. How much longer after you were finally done with the hospital did you return to residency?
Oh, after? So I think the whole medical leave was a little over a year.
About a year,
A little over a year. Yeah.
And you still didn't have that energy.
But since I could eat again, once they were like resected that bowel out and reversed my colostomy, then it was maybe 4 months later I returned. And the best advice was my program director, then Dr. Ball, because he went through cancer himself. He said, do not return full time initially. And what he did for me is you're going to work half a day for like 3 days a week. And then you're going to go to half a day, 5 days a week. And then you're going to add like 2 full days. So it was a very gradual thing. And you know, you're a resident. You're like, I can do this. Like, I'm going to go. Yeah. But that was the best advice because I did not realize like how fatigued I was in the end. Yeah.
Physically, emotionally, both?
Both.
Yeah.
It was so traumatizing to be back in the hospital and see the patients. Because one thing I've learned after being in the hospital for 4 months and nobody able to figure out anything, but you can't go home either. You're just like, you're there while nobody's, like, people don't even round on you anymore. I was that patient. And I've learned like hopelessness after about a month. Like initially the first month you have a little bit of fight in you despite the ICU stay. Despite that, you're like, and then after a month you lose that feeling of wanting to go home. and you're just so compliant with everything they tell you to do. I'm like, okay, that sounds good. Even though you know that's not going to work. You know that's not going to work, but you say, okay, do it. You just do it. And that is something that I recognize in patients a lot now. When I walk into the room, patients who had complications after complications, or for whatever reason, I can recognize it in their eyes. I'm like, oh, wow, I know exactly where you are. And it's hard to see.
Unless you've gone through it. Then you can see.
Yeah, it's very evident. I'm like, whoa, you can see it immediately. They can be smiling. They can be saying all the right things, being like, yeah, I'm very motivated. But it's behind that expression of like, oh, wow. Yeah. And it's hard to, it brings a lot of emotions out of me. Initially, I couldn't control it. I wanted to avoid it at all costs. But now it helps me like, oh, this person needs extra time. The exact way that the residents and the attendings who took care of me gave me extra time because they probably recognize that in me too. These are the patients that I need to give extra time to and make sure I see them in the end of the day instead of the beginning of the day where I can or know to circle back to those patients after work and just give my undevoted time. It's like, okay.
So it's changed you as a physician, makes you a more in tune physician.
Yeah. It does. I remember though, one thing that was really hard when I first came back, people would say, oh my gosh, this must really change you as a doctor. You must really be able to relate to the patients now. They would say that. And my answer would be, yeah. But in the back of my mind, I would be like, so I went through all of that to understand a patient better.
Right.
Yeah, because if I could choose to not go through that experience and not understand a patient at that level, I would choose that for anyone I know. Yeah. So although it is a benefit or byproduct of it that I have gained, I wouldn't wish it on anybody.
Well, and I think you're already one of the most compassionate physicians around. So you're Miss Super Compassion now.
Yeah, maybe.
There was, just to lighten things up, you told me a story about, I think, one of the chief residents sneaking you something.
What was it?
Some applesauce or something.
Oh, yeah. Oh, yeah.
You weren't supposed to eat or...
At an NG tube, and I was like, MPO. After 4 months of MPO, you're like, can I just... I remember actually having water for the first time.
Really?
And, oh my goodness. Water is so sweet. It is... And I think that lasted like 2 days. It was so sweet. It's a weird... What I was thinking was, maybe... water is actually really sweet, but we taste it all the time that we don't really know that it's sweet anymore. Like, that's the level of sweetness I felt in the water. And then, even though I was MPO, I just wanted I wanted to eat something. So I begged the chief resident, because I know he was such a nice guy. I was like, please. And I remember one time they gave me, the powdered bouillon, chicken bouillon that they have in the hospital. He brought it to me and he was like, okay, Yunna, like, if you promise that you will just put a little bit on your tongue, I will let you have this. And I was like, okay. And I just had a little bit, and that felt super good too because it was salty. But because I had the NG tube, I wanted to drink a pack of juice. And these are like tiny juices, like this big, the juice pack itself. And he took me to the playground, the pediatric playground. And the doctor, of course, was over there. So I had my back like this and he was sitting here. And we acted like we were talking about something really serious. And I think I was acting like I was crying or something like that. And then he took the juice pack out of his pocket. He didn't tell me he was going to do it. And 2 tiny juice packs. And he said, you only promise me you will be reconnected to the NG tube immediately when you go back. And I was like, I promise. I promise. And we like drank the juice together like 2 little kids. And then we wheeled me back to the room, and then he just connected
With a
me
smile
up.
on your face.
I was so happy. But it goes out so quickly. It's
Yeah.
goodbye.
Well, you get to taste it.
Yeah. It was wonderful. Yeah, I wonder if that helps you actually. If you have a small bowel obstruction, you know how like you chew gum? I wonder if like drinking and having that gastrocolic reflex kind of helps your gut move. Because you have NG, you're going to suck it out anyways.
Interesting question.
Because it's not like you have dysphagia. So that's another cotton candy idea.
Cotton candy. Medical grade cotton candy.
Yeah.
Okay.
I think another thing that Nick told me, because he's my significant other who's a hospitalist, he talked about how he was very against giving benzodiazepines to patients while they were inpatient or things like that. And I was against taking benzodiazepine, even though it was on my PRN medication. And finally, a doctor sat me down. Maybe it was palliative care doctor. He said, what are you afraid of? What do you think is going to happen to you? And I said, well, I'm afraid I'm going to get addicted. It's like, that's not going to happen. Like, you are going through so much anxiety and you're supposed to feel anxious. Like, you nearly died and you still have to go through cancer treatment and like all of that. Because they told me at that point I was too weak to go through chemo anymore. And my recurrence chance was 50% at that point. And he said, just take it. If you don't take it, I'm going to have to schedule it. Or like, you're just going to have to give it a try. Trust me. And I took it. And that really was helpful. I could finally think. I could talk. I could sleep. I could function as like if I was beyond the threshold, and that didn't sedate me at all. It just brought me below the threshold. And what Nick says, he sees that a lot in his patients too. He's more prone to say, okay, let's just give the Ativan a try for a little bit. And he was able to like decannulate a lot of his trach patients with that method. And he said he would have never used that before. Yeah.
What other thoughts do you have for other physicians who might be listening, and you know how everybody practices a little different, has a different style, but you know, when you're taking care of patients who have prolonged illnesses, been on a ventilator, and kind of getting out of that, starting to recover, how can the physicians help patients in a way that they're not really doing so now?
The biggest thing I've learned and how my practice changed is asking the patient. They have the answer. Like, they'll actually tell you the answer. I'm not talking about, oh, I want to be on this medication, or I think we should like increase this hypertensive medication. Not that level. But they'll tell you exactly what they need. For example, for me, because it was COVID time, they didn't even allow you to like open the windows or anything like that. And after being in the hospital for 2 months, I just wanted some fresh air. And I think I asked for a whole month to like, can I just stand by the balcony and like, you can open the door and I'm just going to stand there. And it was really hard to bend that rule because it was COVID time. And one morning, one of the docs came in, I think at like 5 a.m. and said, get on this wheelchair right now. And just wheeled me out and then just put me there outside by the balcony and said, I'm going to come back in 5 minutes. If anybody finds you, say, Dr. So-and-so said I could be here. And that really healed me. I remember just sobbing there. And it was something, you have to have a will to heal yourself or for your body to be healed. You have to have that fight in you. And there is a way your body will tell you, like, this is what you need to get to that level. And for me, that was like nature, right? I like live in the middle of nowhere. And I needed that connection with nature. And I was talking to my palliative care doctor about this, and he said, oh, that's very common. We see that all the time. For example, somebody would say just, I need this specific, like, Mexican food, is what the example he gave. And then you're like, okay, like, we have other foods here, like, it's fine. But then the moment you provide that thing to that patient, they start healing because you have that fight again. And that's what I try to identify in patients. Like, what do you think you need? And then I really, as you know, everybody says this, right? But if you listen to them, which is the hardest thing, honestly, we're so rushed. And sometimes they tell you all these other things, right? Like, but if you really just sit there and listen, they'll tell you exactly what they need. And sometimes that's a strawberry ice cream. I have a patient like that. Sometimes it's just like this, something very specific that they'll tell you. And then they begin to heal. And yeah.
So what I'm also hearing is that sometimes it's good for doctors to bend the rules.
100%.
They help their patients. All in the, yeah.
Yeah, a lot of people bend the rule for me.
Yeah.
And I am so grateful for that.
Good, good.
Yeah.
How about any thoughts that you have for not just physicians but other people who are going through this long, crazy illness? And I guess I want to specify, the thinking of, I want to die. I don't want to die. I want to die.
Oh, yeah. I think don't fight that feeling. Well, first, you're going to lose.
Okay.
Right? It's not like you can, it's almost like, it's literally intrusive thoughts. Like, you're not like actively sitting there thinking like, I wish I was dead. It just comes and goes. And and Nick told me that, and I told my sister too, I mean, it's very hurtful now that I think about it. But I told her, like, why didn't you let me go? Why did you keep me alive for me to suffer like this for years and years, really? And very hurtful to hear on the other end. And what Nick said was, yes, I was taken aback initially when you said that. I was like, oh my gosh, really? What's going on here? But over time, I realized that I just needed to let you be. That was a journey that you were on your own. There was no me trying to help you fix it, trying to convince you out of it, or XYZ. There's nothing that he could do.
Even, you're talking 2-3 years out. Yeah, same thoughts.
Same thoughts.
Yeah.
Maybe the frequency goes down a little bit. But when you have those thoughts, it's like, just let them happen. Don't try to fix it, because there is nothing to fix, really. I think it's just a natural trauma response of like, okay. And when the body and mind is ready to open up a little bit and process a little bit, it'll do it at its time. I don't have to force myself to do it. It'll just like, something will bing, pop up. It's like, remember that time in the ICU? Bing! And you're just like sobbing for days. And you're like, okay, now I processed that. And then it'll come back, another thing in that time. And yeah. Nick said, so when I was in the hospital, I was exhausted. And there would be times that I wouldn't contact him for a week. Like, I wouldn't text him back because I was exhausted and I was so out of it. And he was in Michigan. I was in California. There's no way he would know like whether I'm alive or not, because that's when he didn't hear back from me for days. Last time, like, I was in the ICU intubated. So despite that, he was so patient. He let me be. He said, Yunna, maybe every 3 or 4 days, just text me.
So I know you're alive.
Yeah, so I know that you're alive. And I don't have to like fly to you right now or something like that. And at the same time, some people were very like, are you okay? Tell me how you're doing. What's going on? Like,
Yeah.
Please text me back. I'm worrying. That was really exhausting to me. And now I understand. You know how like you go into the patient room and sometimes their phone is off? And you're like, can you please turn your phone on so the outpatient clinic can call you to schedule an appointment? I understand why they keep that phone off now. Because you just do not have the capacity, to answer other people. So, that was a weird feeling.
Well, Yunna, you're an incredibly strong person to make it through all that. And in spite of, the physical struggles, the emotional struggles, people around here at Mary Free Bed don't see that. And it's because, you've always been, even before this illness and now, you were the person here that walks into the room and lights it up. And she brings all these treats for the, half of them are Korean, so you don't know what's under the wrapper.
And I do not know. I don't write what's in there.
No.
Here you go.
No. And she's unofficially known as the hospital's CHO.
What is that?
Chief Happiness Officer. She really, I mean, when she was in California, and I don't know if the medical group sent out a care package or something.
Oh, yeah, so many care packages.
And then she sent all these thank you coffee mugs to the medical group.
Everybody was
always
amazing.
Thinking about everybody else.
Everybody was so kind. It really was. It felt like I had a whole country behind me, not a village.
Yeah, you did. You did.
Yeah.
Well, we're very happy you made it through. Very sorry you had to go through that. Hopefully it's you see the benefit of that and focus less on the downside, because you still have ongoing issues for the rest of your life.
Yeah, that's true. I think maybe in closing, I was talking to a friend who had a significant illness. And that's like a lifelong illness complication. So it wasn't like cancer where you have it for a little bit and you don't have it anymore. And he said he lived with it for, at that point, like 17 years. And he said, I'm happy I went through that. And I said, well, wow, I'm not there. I said, I don't think I'm ever going to get there. Ever going to get there. I'm not happy. I'm bitter I went through this. I'm mad. But after 4.5 years, like I think 2 weeks ago, for the first time, I had that thought. I thought, when I was like seeing this pediatric patient in the hospital, and I could really relate to that patient, I thought, for the very first time after 4.5 years, I'm glad I went through that. So maybe to my former self, I would say, hang in there. You're going to get there.
Yeah.
It seems impossible to you right now, but one day you're going to get there. Yeah.
You've been watching The Summary, a podcast from Mary Free Bed. I'm your host, Dr. Doug Henry.
And I'm Dr. Yunna Sinskey.